All right, welcome back. If you have receding gums, well, have no fear. A lot of people do, and there's a new way to fix them. Apparently, it doesn't hurt a bit. Here to tell us all about it, the Lunchtime Gum Lift is instructor Dr. John Chao, who is the inventor, actually, from USC School of Dentistry, and Dr. Shah. He's a dentist in San Marcos. Good morning to the two of you.
Good morning.
First of all, the statistics say 50% of people over 18 have this problem?
Yes. So this is surveyed by the American Dental Association. It's quite prevalent, but it's a problem that doesn't lend itself to easy solution up until now.
And you came up with this idea. Basically, how does it work, and why is it not painful?
Okay, what we have until the advent of this invention is the gum grafting method, where
just that sound makes it hurt. Gum grafting, right?
Yeah, gum grafting. That is, take a piece of gum from the palate, from the roof of the mouth, and tack it on to wherever it's needed. And it's not so comfortable, and it does have complications afterwards. But so I came up with this new method where we go through a pinhole in the gum and lift the gums up and slide it to where it belongs, and in a very short time it's restored to its regular position when you give the patient back the smile that they're supposed to have.
Now there's about 500 doctors around the country that are practicing this now, including Dr. Shah in San Marcos.
Yes.
Doctor, tell me your experience with this.
Yeah, the patients have loved it. It's like he was saying, a new option versus the traditional grafting. So most of my patients were scared of going the original route, and now they have something. You know, we can perform the procedure with no cutting, no grafting, no stitching, quickly, relatively painlessly, and they're able to leave with an immediate result.
Its name is called the Lunchtime Gum Lift. Is it really? Can it be done over lunchtime?
Very quick. Very quick, yeah.
It's very quick, and Brandy was curious if it was painful, because she has a little issue there. But it's not painful.
She's going to do great.
And she's going to do great.
Yeah, it's because there's no cutting, there's no scalpel, there's no stitching. Everything is done through a tiny pinhole with specialized instruments. So on the average, per tooth is about 10 minutes. It takes less time to do this than to do a filling. As
far as costs go, I'm sure insurance handles most of it, but if you don't have insurance, is it similar in price, less expensive? How does that all work?
It's similar to the gum grafting procedure, probably a lot less, because it takes us less time to do this Lunchtime Gum Lift.
Right.
So affordability-wise, it's comparable, but a lot of times it's much less.
Dr. Chao, how often do you see this just in your practice?
Oh, I see it. At least 50% of my adult patients have
so that statistic holds
I think even higher.
Yeah.
And I would refer them out, and they just didn't want to go through with it. And I see them routinely, and they end up. We finally have a new option.
And more people are willing to go through something like this.
Much. Yeah, the turnover rate is much higher.
Doc, for those who want more information about this, or to choose a doctor like Dr. Shah in San Marcos, how do they go about doing that?
Very easily. They can go to the internet and click lunchtimegumlift.com.
Simple as that.
Simple as that. Lunchtimegumlift.com. And they go to the website and click on Find a Dentist. And all the dentists will be listed by location near them, and it would be very easy for them to find a Lunchtime Gum Lift dentist.
All right, doctors, thanks for coming in and sharing that with us. We appreciate it.
It's our pleasure. Thank you so much.